Welcome. We are giving everyone about a minute. Welcome to Black Mothers Matter. Childcare is social justice. We'll start in about a minute.
Wow. Something just happened here for my screen. Sarah, can you guys hear me?
Yes.
Yeah, we can hear you.
Clear. Great.
All right, I'll start. Good evening. Welcome to Black Mothers Matter. Childcare is social justice. My name is Sarah Idrisu, and I am the co-founder of March Like a Mother for Black Lives, and I'm also the executive director for Educators for Excellence. We're so glad you can join us, and so happy to say that we have over 400 people joining us tonight. And so I'm really excited for this amazing conversation.
And my name is Sarah Muncie. I'm the co-founder of Neighborhood Villages, along with Lauren Kennedy. We're all here tonight to center the voices and the experiences of Black mothers in America. The experience of becoming a parent should be one filled with joy. We should be able to trust our doctors to listen to us and support us through our pregnancy and childbirth. But Black women in America die of pregnancy-related causes at almost 3 times the rate of white women, even after accounting for income, education, and any other factor. So we're here tonight to say that the lives of Black mothers matter. And while about 76% of mothers and 96% of fathers with children under 6 work full-time in America, we're the only industrialized nation on this planet that leaves childcare up to parents to figure out on their own. We should be able to find affordable childcare where our babies and children are loved and deeply known so that we can work and support them. And we should be able to present ourselves in our places of work as our authentic selves without having to pretend that we don't have children. But that isn't the reality in America, especially for Black mothers. Parents are left to make impossible choices about their careers, often leaving the workforce for a few years because of the cost and availability of childcare. The effects of these choices last well beyond that day when your child enters kindergarten. A 27-year-old Black woman earning the median income in this country will lose more than $500,000 in lifetime earnings for leaving the workforce for 5 years. But with vouchers hard to qualify for, hard to keep, and increasingly more difficult to find a provider who'll take them, and childcare deserts all over this nation, people are sometimes left with no choice. The time has come to fix our nation's childcare crisis because every parent in America has the right to parent joyfully and to provide their children with the life they've imagined. And until that is the case for Black mothers, the American dream will be just that, a dream. It's time to make good on the promise of this nation.
Thank you for that, Sarah. So when we say Black Lives Matter, we also mean Black families matter, Black maternal health matters, Black life matters in every stage of life. We're thrilled to be joined by an amazing panel. Dr. Michelle Sanchez is a principal of the Epiphany School and Epiphany Early Learning Center, a groundbreaking tuition-free private school open to economically disadvantaged families in Boston. Dr. Renee Boynton-Jarrett is a practicing primary care pediatrician at Boston Medical Center, a social epidemiologist, and the founding director of the Vital Village Community Engagement Network. Latoya Gale is the executive director of Boston School Finder and the co-founder of March Like a Mother for Black Lives with me, which seeks to leverage the collective transformative power of motherhood to eradicate systemic racism through grassroots advocacy. Our panel tonight will be moderated by Congresswoman Ayanna Pressley. Representative Pressley serves the 7th Congressional District of Massachusetts, and she is also a proud bonus mom of 12-year-old Cora. Pressley's career has been marked by a relentless determination to advance a political agenda focused on women and girls and breaking cycles of poverty and violence while healing trauma and modeling joy as a necessary act of resistance. In 2009, when she became the first woman of color elected to the Boston City Council, she provided the intellectual diversity that the council desperately needed and codified and prioritized the needs and experiences of women, families, and communities through policy and participatory democracy. Her innovative and responsive policy priorities arrived through deep listening and partnership. When she was elected to Congress in 2018, she brought both the issues that she always championed in Boston and all of us to Washington. We're honored to have her here tonight. And with that, I'll hand it over to you, Congresswoman Pressley.
Thank you all so much. And before I get into some brief remarks, in order to authentically honor this moment and this incredible virtual table that we're creating this evening, I do just want to bring my own mother into this space. You know, I was raised in a single parented household. My father cycled in and out of the criminal legal system, many destabilizing factors in our household, including the fact that since my mother was caring for me alone, that she could not afford childcare and was often afraid to tell employers that she had a child because she felt that it would work against her. And so maybe from the age of 5, I was a latchkey kid, and we had a lot of rules about how I was to conduct and to carry myself, and to not tell people at school that that was the case because my mother feared that I would then be taken away from her. Just 2 quick stories. When my mother she'd been laid off. She was in her 50s, experiencing ageism and other barriers to gainful employment. And she asked me to take a look at her resume to give her some pointers and some tips. And when she gave me that resume, at the top of the resume, it said, Ayanna Pressley's mother. And I said, Mom, that's your problem right there. This reads very eccentric. This is inappropriate. And you need to remove this from your resume. And she said, that stays. You can change anything else you want, but you are my proudest achievement. I offer that because that's the sort of soil that I've been rooted in. And am very blessed to be able to say that. The final story that I want to share with you before getting into my brief remarks is one that is another real life scenario that's occurred in the midst of this pandemic, early in it. And a Black woman, an essential worker, a single mom raising a daughter, again, mirroring my own family model, called me at 11 o'clock at night and said, I'm an essential worker. I don't feel well. I don't have anyone else to care for my child. The schools are closed. Representative Pressley, you know, I don't want to go to work. I can't bring my child to work. I don't know if I'm sick and I have COVID. I don't want to make other people sick. If I don't report to work tomorrow, can you assure me that I will still have a job because I need to stay home with my child? That is unjust and unconscionable that would ever be the concern, that a parent would be forced to work ill and have no other recourse with which to care for their child. So now I'll get into more formal remarks, but I did just want to offer, and we'll hear more real life scenarios like that. So thank you to March Like a Mother and Neighborhood Villages for bringing us together in community tonight, holding critical space to center the voices of those on the front lines. Now let's be candid and honest about this. Black women have been at the front line of every economic and racial justice fight, ushering in new movements, and often we are hidden figures in those movements, but not tonight. Again, we've been leading not only movement in the street, but also in community building, family building, caretaking, work that has built a framework for true equity and liberation, one generation at a time. The collective care and mutual aid that I have seen throughout this pandemic has been fortifying, inspiring. In this moment, we must center the voices and leadership of Black women because while we have been clear, we have not always been heard. An activist friend of mine reminds me to not use the term voiceless because no one in our community is voiceless. What we are is unheard, which is why we must be intentional and intersectional in our approach. We know whose we are, we know who we are, and we know who we are accountable to. So let's get to it.
Congresswoman Pressley, we're going to skip the video section of this
Okay.
and go straight to it.
Okay, great. Latoya, to open up this conversation, are you there? Okay.
Yeah, I'm here.
All right, I want to turn first to you. You and Sarah organized, Sarah Drisu, a powerful show of solidarity on the steps of that church in Copley. Tell us what you heard from mothers on that day as they were dealing with a pandemic within a pandemic, both a public health crisis and a moment of national reckoning when it comes to racial justice.
Well, I think the biggest thing that we heard from mothers is thank you for centering us and our experiences. And the beautiful thing about it is it was a show of solidarity. We centered Black mothers, but we had all moms show up that day. And it was really a chance for us to normalize motherhood and to normalize Black motherhood and to control our own narrative. As you said before, people might describe us as voiceless. We are not voiceless. And we wanted to showcase that. And we also wanted to showcase that Black lives matter, not just if we are gunned down or killed, however we are in the streets, but our whole life matters. The whole trajectory of our life matters. And that's why we focused on some things that we're talking about here today: economic justice. We focused on Black maternal health. We focused on education. And then we, of course, focused on public safety. And it was beautiful to have Black women sharing their stories, sharing their experiences from all walks of life. We heard from mothers who had lost children to police violence. We heard from mothers who are working in this field and maternal health, who are starting maternal health centers here in Boston. People were shocked to hear that we don't have that here in Boston. And we heard about economic justice. And that's why we were really excited to join with Neighborhood Villages for this call tonight. Because when you think about economic justice, Black women have always been in the workforce. You described your mother, that describes my mother too. Black women have always been breadwinners. And when we have created, when society and the systems have been created that don't support Black women being able to have economic mobility by making it difficult and expensive to find childcare, to making it seem like you're lazy or it's out of the norm for you to say, hey, my child comes first. I need to take care of my child and I'll be back at work. And then thinking about when you look at data, when you look at statistics, if a woman who works is supported in that and she has quality childcare, she can concentrate on work. She can set her family up so that they can be productive members of society and be self-sufficient. And we have to change that narrative. And so I'm really excited. I'm super excited to be on the call with all of you guys. I fangirl over Dr. Sanchez and Dr. Boynton Jarrett. Anyways, I love them here in Boston. They're wonderful women. They do amazing work. Like, they know that I love them. And it's really a time that we normalize Black motherhood. And we heard that from women, and we heard from women, how can we help? We heard, we are powerful. Thanks for showing everyone that we're powerful. And we want to keep that up. We want to keep up that momentum. And so we wanted to have this discussion about childcare and how that relates to economic justice for Black mothers. And so
I love that. Latoya,
yeah.
I appreciate the point you're underscoring, that we are powerful, because when you are experiencing the impacts of a patriarchal society, of structural racism, the comorbidities of that structural racism, and intersectional oppression, it is easy to lose sight of the self-agency and determination and the power that you do in fact have. And I also just want to say I had a number of a family, immediate and extended, that participated in the march. And thank you just for centering joy. I think that's also important, because our bonds as a community can't all be formed in traumatic events. And so we want to hold space for that as well. Sarah Idrisu, is there anything that you wanted to build upon?
Absolutely. Mothers are the best activists, and we're often left out of the equation because we have to care for our children. And so we are creating intentional space to show that activism and show that power, and not just when we are in tears, right? And every step of the way, you'll hear our voices. And so we've heard from mothers who appreciated that. And we can only imagine what that force will look like in order to create a more liberated and just system.
So Renee, from your work and your perspective of health equity, what does justice for Black mothers mean? America's healthcare system is another example of how racism is built into our country's foundational structures, deeply embedded. So how does your work with Vital Villages dismantle that? And from your perspective, what structural investment should we make in both healthcare and childcare to address equity issues in order to set Black families up to do more than to survive, but really to thrive?
Thank you so much. I'm honored to be here with everyone tonight, and I have so much to say about that question. But where I'll begin with is the media right now, we're all talking about safe return to school. How do we ensure physical safety of children as they return to school? Well, I'm a mother of 3, and many of us here in this community are mothers, godmothers, other mothers, aunties, to children who will be returning to school carrying so much with them, carrying the trauma that they've witnessed and experienced over the past few months, carrying emotional burdens that have been underappreciated, invisible, ignored within our society. And there's very little conversation about those burdens and about their safety, their emotional safety, their mental safety, and how this is impacting their life chances. So for me, equity and justice as a Black mother means re-inscribing, rebuilding the social contract that is broken over and over on a daily basis with Black children in this society. It is wonderful that there is so much desire to ensure the safety of Black people in this society. Safety is not my goal as a mother. Safety is not my goal as a pediatrician, and safety is not my goal as a neighbor for anyone's child. Safety is a very low bar. My goal is fulfilling promise, potential, joy, and happiness. And we have to raise the bar on what we are fighting for children in this society and in this community. And so when I think about health equity, sometimes I think we just need to throw that term out and replace it with something that really taps into humanity. We need to replace it with dignity. What does it mean to respect the dignity of Black mothers? What does it mean to respect the dignity and protect the dignity of Black children, Black men in our community? And LaToya kicked us off with the word love. We have to lean into a space that is way beyond this sense of emotional guilt into a sense of love for our community and embracing the differences within our community so that we can love each other. Because I don't think it's going to be strong enough for us to have a sense that we need to do something right or an emotional tugging. And so when I think about the work we do in Vital Village, we are really in a position of listening first and acknowledging and appreciating that members of the community have solutions, they have wisdom, they have ideas that have been, as you said, Representative Pressley, unheard. It's not that they don't exist. It is not that they're waiting for charitable contributions and donations and ideas to come to them. They have been unheard. So our work is all around aligning, centering and aligning around that wisdom, supporting that capacity and building out opportunity structures that really respect the dignity of the human beings within those communities who have ideas, who have wisdom, and have probably a stronger desire than you and I can develop overnight to see their children thrive. And I'll just give one more simple example.
Yeah, please.
Boston Fed, back in 2015, looked at the household median net worth for Black families, right? 5 cities, Boston was the lowest. It was $8. $8 versus $247,500 for white families. So we can sit here and scratch our heads and develop case management programs and new clinical algorithms and models and new programs and services, or we can acknowledge that there was a systematic disenfranchisement called redlining that prevented home ownership and prevented access to a pathway of wealth that would be protective for health and well-being and thriving for families. So until we're ready to have that conversation, we're not talking about health equity. We are dreaming and thinking and acting way too small.
Yeah, so I so appreciate that point, and I appreciate Sarah Drisu's point earlier that mothers are the best activists. You know, we're also the best teachers and the best innovators. I joke often that, you know, more often than not, they'll define Black mothers as angry, but they don't know that that righteous rage is rooted in radical and deep love, or they'll consider us disruptive because we do shake the table in whatever room we're in. But if we were in Silicon Valley, they would consider that disruption to be innovation. So I so appreciate both of those points made by the two of you. And now I'm going to turn over to Michelle. Michelle, last week I had some choice words for Betsy DeVos that seem to resonate with a lot of people. You know, I am hearing in community every day just the very real and palpable fear from educators, from parents, from our students, from our children, as we all think about reopening early education programs to meet the needs of families, but also to protect the health and well-being of the child care workforce, while also trying to keep our babies safe. So how are you balancing these multiple needs as you make your decisions during reopening? And how is childcare a critical part of racial and economic justice?
Great question. This is absolutely one of the most challenging and daunting times for me as a school leader. I'm committed to not only my kids, but their families, and it makes it much harder to just make a decision. Any decision I make has a negative consequence on someone that I feel very called to serving. And there's this absolute real fear from stakeholders about reopening in early education programs and in schools. And the issues of equity and access to early education is not afforded to everybody. And we are in this situation where we're trying to advance that equity to high quality childcare. We're trying to be a space where we know that childcare is a critical part of balancing this equation of racial and economic justice. We know that staying home has had negative consequences on Black and brown children's overall education, social emotional growth and development. And you talk about the trauma that they've experienced in the house, and we're very anxious to get our babies and kids back in our space. And at the same time, we know that our communities have been disproportionately had negative consequences of COVID. And because of, we already are experiencing the health inequities that are exacerbated, COVID just makes all of this much worse for our families. We're anxious to get them back to provide a safe and loving environment for our kids so that parents can go back to work. We have parents who are trying to go back to school, and even in the online version of school, it's very difficult to do when you've got children running around. You know, I was trying to run a school, open an early learning center, and, you know, get my own 2 kids through their own online schooling, one of which had a very difficult time. None of this has been easy for anybody. I've witnessed a teen mom months away from graduation be unable to finish because her 2-year-old was just too much to handle while she was trying to do school and tend to anybody who knows a 2-year-old, and especially during this time where they become so attached to their parents, it's really hard for them to get anything done. I've watched a mom who was right before COVID extremely excited that she was offered her first union construction job and hasn't been able to take one because we haven't been open. So it's just, the stories can go on and on. The progress that we were making with families has been halted, and now it's time for us to make sure that damage is not irreparable. And as a child care center director and principal, I'm always feeling torn. I know that we need our teachers to show up for work. In order for the rest of the world to go back to work, you need to have the child care teachers show up. But I also know the early ed workforce is predominantly women of color, and they're being forced back to work irregardless of how they feel about their own health and safety in order to provide for their own families. I know my teachers will show up because irregardless of their own personal feels, because they just know they must, they know the children need them, they know the families need them, but it doesn't mean they're not all scared to show up every day in fear for their own health and what they may bring home to their parents who maybe live in their home, or their children who are spending time with grandparents. Going back to school must be done carefully without a hurry up and get the kids back mandate. It's not helpful at all. We've spent months working to ensure that we're able to do what's right for our kids and families. Teachers are all nervous, and it's our job to kind of think about all the different points being made around equity and how to get the kids back as safely as possible in terms of COVID, but also with the integrity and dignity. I love, how you put that the dignity they deserve and the families deserve in this work.
Yeah, Michelle, thank you for that. You're holding space for so many things, and the Epiphany has just been an incredible model of providing a safe and supportive learning community, and often the most continuous variable in the life of a child. And you've been a great model when it comes to those wraparound supports as well. I don't know, what I'm hearing is that our educators who were already asking to do so much, now we're also asking them to be caseworkers. And in some instances, because the precautionary measures have not been taken, because there was a lack of, people moved too quickly, or there wasn't PPE, that instance that we saw, I believe in Arizona, martyrs. And we don't want that, certainly not for any of our educators. So thank you for the efficacy and the compassion with which you hold space for all members of your learning community. So, I was mentioned earlier that I refer to myself as a bonus mom. I'm so fortunate to be a part of the village of parents raising our 12-year-old daughter, Cora. And without a doubt, especially these days, she is on my mind. I think about the world that I want her to inherit. And hopefully it is one that is a legacy that is defined by brilliance and racial justice instead of intergenerational trauma. I'm also thinking about where these systems level conversations meet the practical challenges of a family trying to navigate this moment. Is there anything else that each of you would like to share about your personal experiences at this moment in time, be it as a caregiver, as a Black woman, or just as a person in the midst of unprecedented times?
Does anybody want to jump in? If not, I'll jump in.
I'm happy to jump in.
Okay.
My first job was at the Sunflower Daycare Center. I hope they're not on this call. I was paid under the table. I was a 7th grader. I was doing everything in there. And I thought I was like selected, because I was great, But, of the 1.5 million childcare workers in the United States, 40% are women of color, right? And we look at what's happening with childcare right now, and we're wondering why there isn't more urgent action to shore it up, to take care of these essential workers, to protect their safety, to provide them with the resources and the investment they need, because we know childcare is vital to reopening our economy as well. Even if you didn't care about the child development piece of it, right? If you cared about it from an economic standpoint, it's vital. But you know what? There's a long history of not caring very much about childcare or caring very much about childcare workers. They're underpaid, $11 an hour, $12 an hour, 15% live below the poverty line. This is a systematic disinvestment from an area of essential work that so many of us depend on and are a part of in a variety of different ways. And we wonder, how are we going to work through this without addressing the structural racism within that field and the structural inequities in underpaying women in general underpaying women of color, and not really caring very much about their safety or safe work conditions, and not even really talking very much about it. It's coming to the forefront now, but it's been under discussed for a long
So
time.
let me ask you a question about that. You know, people often talk about how they can't wait until we return to normal, which is something that I reject because the normal, that status quo, was unjust, insufficient, and inadequate to begin with. So does anyone also just want to build onto that and talk about, you know, if it's not a return to a status quo normal, if we are going to usher in paradigm shifts across the board, what should this paradigm shift look like in the state? What needs to be happening?
Absolutely. That bothers me too when I hear that return to normal, because normal wasn't working for all of us. And so we cannot return there. When I think about it, I think about the disproportionate number of Black mothers who are in jobs that they cannot telecommute to. So during this pandemic that we're in, while we're worrying about our physical health from COVID and from whatever other structural racism that's out there that exists, I need our system to respond in a way that says, I see you and I care about you and I care about your children. And so what are we going to do about it? I just read a study that said 80% of African American women would vote for an elected official that supported early childcare. And so when we think about, I want moms, I'm going to always go back to that power that we hold. I want us to remember that I think a lot of times when we think about who we hold accountable for things, we think about K through 12, and we don't think about those early years and who is supposed to be and how should systems be supporting women in those early years before you get to K through 12. And our systems have to respond, because our normal going forward needs to look like all mothers being supported. It needs to look like you not having to send your 5-year-old home alone with a house key because you're afraid of getting fired. And you have to make choices about, do I work to provide food and shelter, or do I stay home with my child and depend on whoever? We should not have to make those choices, and disproportionately we are forced. When I say we, Black mothers are forced to make those decisions, and that has to stop. I see Michelle wants to jump in.
Yes.
Yeah, come on, Michelle.
So I also wanted to add, exactly what you're talking about, but we know also how important those first prenatal and couple of years are, in particular, to the brain development of a child. Mm-hmm. And this is, science that I think has been there for a long time, but we're kind of catching up in this world of learning about how the effects of poverty and growing up in trauma can be mitigated through different actions that we as a center are trying to do. And I think a big part of what Neighborhood Villages is trying to create is a system of really high quality childcare. And that means not just focusing on, the love and care and connections that you're making with the babies, but also really supporting the families. And, I often say moms, but it's also, hopefully continuing to keep dads in the picture as well. But and a lot of times it's the work with the moms and supporting their growth and their social emotional development and rebuilding, their own self-esteem and helping them get through school and helping them get through career decisions, and kind of like battling every single hurdle that, the number of things that get in the way of a young mom or a new mom just kind of being able to be a mom and do what's supposed to happen is really incredible. And it often feels like, when I think about the stories and the lives of our families, it feels like I'm writing fiction, because you never really understand, what happens day in and day out, or maybe you do if it's a life you've lived or a population you've worked with. But it's really clear to me why things go badly so often. And the system is really set up not to support our families, but to create these hurdles and create these obstacles, including healthcare and housing and violence in the community and all these things that every day affect our mom's ability to even get out of bed and bring their baby to a center, never mind get up and go to work or get up and go to school. And that's kind of the work that has to be ingrained in these childcare centers, in the kind of work that, if it's not happening citywide and service-wide, it's got to happen somewhere. And that's what we're trying to do, at Epiphany, and also through creating the Neighborhood Villages network that hopefully could expand to lots of different centers where lots of families can benefit from it.
Michelle, let me ask you a question, just building on that for a moment. One of the things that I've been concerned about, of the many things where it seems that there's efforts to rob us of our peace of mind, our humanity, our civil liberties and civil rights at every turn with this administration, is the push to reopen being driven by market and economy and profits and not people and science. And so, with this push to reopen schools, how do you ensure, just based on the conversations that I've had, just tangentially, that I've sought out, that it just seems that educator voice is often not being centered, that educators are not a part of the process, are not being consulted, or not being conferred with, which is a cruel and very dangerous irony. So how do we make sure that the voices of educators continue to be, or are centered in the midst of these discussions?
Yeah, no, I think, it's a great part of my work, and I'm able to do that, but we unfortunately live in a world that, things are not being done the way they should be done. And I think that is where the work has to happen. And educators need to be at the table. All of our, we work in a world where we're including educators in the process and talking in families as well. So where do you feel most comfortable? How can we do this? How can we get your children and your babies here and you feel okay about this and not feel torn, when you're walking away or thinking like, I don't want to drop my baby off. I'm really scared, all of these things, or, I'm not quite ready to go back to work, but, I'm about to be, as soon as this eviction hiatus is held up, I'm about to be evicted from my home. So all of these things that these families are worrying about, but I think getting the teachers at the table, and again, and it's still a very difficult conversation because I know there are teachers who, maybe are new parents who are not quite comfortable coming back to work. So trying to find opportunities. We have some, teachers who have who are, have immunocompromised themselves, and coming back to work is really scary for them. And trying to find ways to support them where they maybe don't have to come in. So maybe it's some virtual learning or some streamed classrooms for teachers to not be exposed to so many students, but really kind of working in that community to make sure that each voice is heard. But also I am, my own bias is to get the kids back in my space. I've heard week after week, in particular with a lot of my young teenage, preteen girls, that they're having a lot of social, emotional depression, anxiety, and it's just made me more and more realize like how important that social connection is to kids. Probably all kids in general, but in general, the young women are really having a hard time with this separation. So even building ways to kind of create more of those connections. But it is that balance of how do you, get the schools open so parents can go back to work, so kids can, not continue to, because online learning did not work for a lot of our kids, or virtual learning did not work for a lot of our families. So how do we get them back in the building, provide them with the social emotional supports they need, but also support the teachers who are really unsure about coming back to work.
Right. So it's not an or, it's an and how do we have that equality of voice, both for educators, administrators, for parents, and for students as well, which is a perfect segue actually to Sarah Drusu, who is a relatively new mother and a former educator and teacher, holding space for all those experiences. What are your thoughts, Sarah, just building upon what Michelle was offering?
Thank you for those reflections, Michelle. I've had the opportunity to speak to over 1,000 educators in the Boston area, either through polling or one-on-one conversations and surveys, and about 40 of them are caretakers, 40%. Wow. And what they've expressed is they have to think about reopening schools without somebody else thinking about how their children are going to be taken care of and how they can re-enter the workforce. And the dichotomy is maddening. And the feeling of, you want me to care about somebody else's children, which I would love to do, but my own babies aren't taken care of, is something that's very palpable. And I know that right now We are hearing from educators that they don't feel listened to at all. And they're feeling a sense of despair that's driving them out of the workforce. And we're going to see a brain drain. That means our most experienced educators might be left out. And in the long term, we're going to lose learning. Quality learning comes from quality educators. And if those quality educators don't have an incentive to stay, then we're going to have a long-term damage to the education system.
Sarah, give those numbers again. You said 1,000 and 40%. Could you enumerate those numbers again from your
Yes,
survey?
we surveyed over 1,000 educators, and about 40% of them share that they are caretakers to young children
Yeah.
in the Boston area.
Yeah, and that's a big, the idea of these school systems that are creating 1 week on, 1 week off. When you're a teacher and you've got a, second grade child at home, how do you go back to school full time when your child is 1 week on and 1 week off? Do you now have to pay for childcare on top of school or childcare where somebody can ensure to get your kids through the online learning? There's so many pieces of this that just don't work for teachers.
Mm-hmm.
Yeah, and Renee, we all have been bringing up the word trauma a lot here, and just as you so eloquently put it earlier, just what our kids are carrying in their emotional backpacks already, and that's been compounded by the unrest in our nation and this pandemic and the financial hardship that families are experiencing. And I think a lot about that, with Cora, and how much I would love to pass along to her. Generational wealth and wisdom and joy instead of intergenerational trauma. Could you just talk about that, in terms of, given the conversations that I've had with educators who describe the trauma-informed social-emotional response we need at scale to support our families as we come through this pandemic. From your vantage point, what are you seeing and hearing and observing, and what should those practices look like? Because, even if we can take every precaution and safely reopen our schools, that has nothing to do with the readiness of a child to learn.
Mm-hmm.
Or to be whole and to be healthy. I don't want to make it just about the utility of their learning. So just to be whole, to be healthy.
So I've been a fan of educators, but never as much a fan until the past couple months when I've been home instructing a high schooler, middle schooler, and elementary schooler, and whoa. But the first time I was truly in awe of educators was during a period of time when you actually, as city councilor, were holding a series of hearings around about trauma and violence across the city and pushing for trauma-informed schools. And we were having discussions and design meetings with educators about what does trauma-informed practices look like in their schools, led by the Child Witness to Violence Project and my colleague, Dr. Nina McConico. And that, for me, was probably the most important learning that I've ever had, was learning from educators what it is like to go through an 8-hour day with a child that might be experiencing very deep, very severe and very cumulative forms of adversity and trauma.
Yes.
And how they would redesign their classrooms, their systems and school systems. And I think that it really begins with listening to educators. It truly, and for us, this has been said, Dr. Sanchez just said this, right? But we don't really hear it, right? Because it's a mindset shift. Because the idea that educators actually would be the designers of our plan through the COVID-19 pandemic.
The audacity.
Exactly. So we actually have to work at that very basic mindset change so that we are truly open to listening and hearing from those who are on the front lines, who have ideas, who are deeply invested in the success of the children in their classrooms and their schools, and have experienced, and weathered that storm with systemic underinvestments in their well-being, underinvestments in the children's well-being, and some of the systemic factors that have not fixed despite lots of effort to fix them, right? And so we are in a resource-rich city here in Boston, and we can get ourselves together around this, but I think it truly begins with listening to educators and centering around healing, right? And so a lot of times when we think about trauma-informed practices, it's really kind of screen, identify, treat, do special things for children who've experienced trauma. Well, you know, one thing we know about COVID-19 and everything that has happened around raising the dialogue around racial inequities in our society is there is a lot of collective trauma.
That's right.
And we are going to have to reach into deep wells of our intergenerational cultural traditions, our rich traditions of healing, our rich traditions of creating sense of community and belonging to really love children. You know, as a pediatrician, sometimes my patients would say, you know, my teacher doesn't like me. And like someone would start cutting them off as they're saying that, like, oh no, so-and-so. Children know if you don't like them. And they know if they're thought of as bad. And they know if you do not really believe in them. And so we have to create systemic environments in schools where children can be believed in, they can be supported, they can experience a sense of affection, belonging, and purpose. And this may sound fuzzy, and I know I'm the pediatrician who's supposed to be super clinical here, but let's face it, we live in a society where 1 in 1,000 Black men and boys, that is the lifetime risk for being killed by law enforcement, 1 in 1,000. So it's a leading cause of mortality. So we have to sit with that reality, and then we have to really look and see what are children seeing and what do they think about what they see? What do they feel about what they see? Because we can do a whole lot of things that don't erase the reality of how you feel in this race-conscious society.
That's right. That's right. Yeah, and you just remind me that that's a role that we all need to play, that it's not something just to leave to exclusively our learning communities and our schools, or to our healthcare providers and our very compassionate and incredible pediatricians and doctors such as yourself, that this is work that we all have to be actively engaged in when it comes to our children. Anything else that folks would like to offer or elevate that's sort of on your mind while we're at this virtual table? And I do want to just acknowledge, since, you know, I'm being very familiar with all of you, so please no one call me the Congresswoman, because I haven't been using titles. I hope no one is offended by that. We just, I've been feeling very familial with all of you being at this virtual table. So thank you for the insights that you've offered and for lending your expertise to this moment and just for your commitment to community every day. But as we come to a close, any other thoughts that folks would like to share?
I wanted to very quickly address, I think it was a point around, you know, having teachers and training teachers who are not social workers, who are not kind of trained to do that level of work. But I think there's a lot that can be done as a school community in creating a trauma-informed community where people understand what our kids are going to. And I think you said it exactly right, and is what I tell everyone who comes in the door looking for a job at Epiphany, is if you cannot love my kids, you do not belong in this community. You know, it doesn't matter whether you know them or not. You must know in your heart that the second you meet them, they are to be loved and they are to be cared for and they are to be nurtured through their growth and development. And they're going to make 1,000 mistakes and make you mad, maybe every other day, but it's our job to forgive them and continue to nurture them. And that is what we teach our teachers. And the schools also need to have those people who are the professionals. So we do have social workers and caseworkers and therapists and all of that. You know, the children need access to that and have to have those who are trained in that work. But school communities can do the work of creating that kind of environment for the students to be able to unpack and be able to deal with all that trauma so that they can actually learn.
Well, that culture starts at the top. So thank you for being intentional in that. That's not something that just happens organically. So thank you for issuing that mandate when it comes to love. Any other thoughts? So I think we do, because we do want to be mindful of folks' time, and I think we're at the portion in our program where the panel sadly is coming to a close, but this is certainly not a one-off conversation. We'll continue to be in community and in solidarity and in partnership doing this work.
Right. I have a question for you, Ayanna.
Oh, okay.
Oh, here we go. I know. And you can tell me, is there anything going on in Congress to support childcare?
Yeah, I mean, I think ultimately, I find myself saying this more now than ever before, but particularly when it comes to the issue of childcare, I mean, we need those just massive investments in the system at every level of government, including the federal level. What I've been focused on and was successful in securing more recently in the HEROES Act, recent package out of the House, are funds for paid leave. Again, just revisiting this idea of rejecting a return to normal. Imagine how we would have better weathered this pandemic if we already had equitable access to healthcare, if there was universal healthcare, Medicare for all, if there was already paid family leave, paid sick leave, if people were already working at a living wage. I mean, again, only 1 in 5 Black women and 1 in 5 Latinas can even afford to work from home. And so we just see the confluence and this tsunami of hurt, which exists because of these entrenched inequities and disparities along gender and race, which Renee so eloquently underscored was legislated. None of this happened by accident. So what I've been focused on are just those massive investments on the federal level in childcare. My colleague and sister in service, Congresswoman Catherine Clark, has been doing great work in this space, and I'm proud to partner with her in that. But again, my focus has been on paid family leave, and we were able to get some major wins with paid family leave included in the last package.
Wonderful, wonderful. And I wanted to highlight something that Renee said. I think everybody kind of said it, is that our systems have been designed to never put those who are impacted by a problem at the center of solving it. And so when I hear people ask about, I know there was some questions in the chat about teachers, that's just like we don't ask anybody with the expertise. We don't believe in distributive leadership for some reason at systems levels. We need to ask the people who have the answers for the answers. And I hope that going.
Now, was that a setup? Now, now, was that a setup? You need to go and Google. That is my mantra. The people closest to the pain should be the closest to the power, driving, informing the policy making. Thank you for that alley-oop, sis.
There you go. I know you say it. So I even have one of your T-shirts where you say, "My mom didn't raise me to ask permission." I love it. My daughter has one too.
All right.
Yeah.
There's a question in the chat. Okay. I just was there was a question around adding a course on medical racism to health and medical school curriculums. Should have been there already. It absolutely has to be there. We cannot understand the US healthcare system without understanding medical racism. We're not going to improve things without understanding that. That goes for our public health system as well. We need to actually understand how these structures were built, what they were designed to do in order to imagine and build something new.
Yeah, thank you, Renee, for that, because whenever in doing the work, either in the introduction of our Healthy Moms Act around maternal mortality, or other instances where I've underscored how the pain of Black folks, but in particular Black women, has been delegitimized since the inception of this country, especially during this pandemic when we were concerned about the public health response not being equitable when it comes to access to testing and treatment, or people being sent home to die because their symptoms weren't taken seriously. So many people would say to me, these are our heroes. Are you saying, and even doctors would say, some would take offense and say, well, I'm not racist. So I so appreciate the question, and you're saying that this is something systemic and pervasive. It's bigger than one doctor. This is a culture. It's systemic. It's about what what's been ingrained.
Mm-hmm.
And I saw a question about the role that Black men can play in supporting Black women in the early childhood space. And I just think that I learned this by example from my father, who was always the one to take me to the first day of school and was the room parent and all of those kinds of things. And I think that he had to create a space for himself there because he wasn't really welcomed. And I think we really have to think about ways in which we welcome Black men into spaces with children. And we have to think about our culture of criminalizing and policing Black men and Black boys, and the ways in which they're very unwelcomed in educational environments. So I appreciate the question. And I do think it's really an us question because there are ways in which we all contribute to that dynamic.
And I would add that it's a very targeted, like you really have to work to make sure the dads in general know that they're welcome and know that just as much as you're sending a text with a picture to mom, you're sending a text with a picture to dad. And that when you're creating programmings for, for parenting classes or whatever, that dads are invited and encouraged to attend, and that you're holding groups and spaces for dads to feel welcome, to be part of it, where oftentimes you hear, they go into, pediatrician visits and the doctor doesn't even look at the dad and they just kind of talk to the mom, and really kind of creating that space from the very beginning so that dad feels just as critically important to that child's development. And that's a big part of the work we try to do, and also try to ensure that moms also are welcome and willing to, regardless of the relationship with her, figure out how to let that dad be supportive of the work that it takes to raise the baby.
Mm-hmm.
I'm going to jump in. Thank you so much, Congresswoman Pressley, for moderating this amazing panel, and to the incredible panelists for lending your voice and all of your engagement. And so I want to make sure we get out on time, because I'm still a teacher. And it's late. But especially thank you, Neighborhood Villages. A silent hero has Lauren Kennedy, who did a lot of behind the scenes work, and intentionally made sure that we centered Black mothers and Black women by doing the work and setting us up. So I really appreciate it. Thank you, Sarah Muncy, as well.
Yay.
Thank you all. And so with that, I just want to remind everyone to exercise your power. Vote. The deadline to register to vote in Massachusetts is August 22nd. Make sure you hold your elected officials accountable for the discussion we had today. Otherwise, we will continue to put childcare on a back burner and see it as not a real policy issue, when in fact, indeed it is. So with that said, I hope you all have a wonderful night.
Can I add one more thing again, Sarah? I want everyone to, we want to make sure this doesn't go on the back burner. And so we're going to be asking you to share your stories about childcare.
Oh yeah, please.
How that has affected your life and what impact that's had in your life. So look out for that email from us. And go ahead now.
Yep, thank you for that, LaToya. And those stories will be used to share with decision makers and policy makers who need to hear your voices. So
Yes.
to check in on that. All right, with that said, it is 8:00. Have a good night, y'all. Thank you.
All right. Good night, everyone. Thank you all.
Thanks,